The doctor has called you back for a repeat anatomy scan. Like the doctor has told you that they didn't see a few things clearly, or they want to see the baby again in a few weeks, and they've called you back. So generally, patients who come with these complaints in the clinic, they are like losing their shit because their mind has already gone to the worst case scenario, wherein they are imagining that something deadly is going to happen and this baby is probably going to die or is going to be handicapped, something like that. Now, why does our brain do that? Like, why can't we just trust what the doctor said? Now, when the doctor or the sonologist says that, it's literally because the baby is stubborn. Sometimes they don't move. There are certain organs, because in this anatomy scan, the sonologist is literally looking at parameters from head to toe and certain other structures. So they want to just they know what looks normal, and sometimes they don't see it clearly. And sometimes there is a problem. There is small something is seen. Now that small something is not necessary that it's a problem. As in, suppose there is little swelling in the kidney of the baby. It disappears after delivery. Suppose something they saw in the heart of the baby. It's pretty normal finding. Something they saw in the brain of the baby. It's sometimes a normal finding. But they want to just look at it or follow it up because that doesn't look like a normal baby, because they are seeing normal babies so much and this doesn't look that much anomalous. Now, suppose if there is a problem, a defect in the baby. When that happens, the doctor wants to first of all be absolutely sure because they picked it up and that's why they want to see you again. And if that is the case, they want to make a plan of action to tell you what is going to happen. But for them to tell you what is going to happen, they need to be sure. And sometimes they're not sure because they don't see the baby properly. The baby is stuck in one place. Or some defects, they actually evolve over time. So if that is the case, and time is the only factor which will decide what is going to happen, would you not like to wait? And how would you manage your mind in that time? Now, in this moment, when you don't know what is going to happen and it really scares you, I encourage you to stay scared. Instead of resisting the fear of uncertainty or trying to just do Google search or go to other doctors or, eat more, start getting depressed about it, start creating more stories in your mind. Instead of doing all of that, I would just encourage you to be scared. Just really go to that place. What if there is a defect in the baby? So if there is a defect in the baby, there are two things that can happen. There's either it will resolve or it won't. So if it resolves, then half of your worry is gone, really. All that what you worried for was not of any use. And suppose if it didn't resolve, or it worsens, or it is actually a part of a genetic problem, or your baby dies. That's what we have to face. And if something like that happens, that you lose your baby, how would that feel? Yeah, that's just let that sink in. If that happens one day, we can't lose everything that we have. It's a strong possibility. It's always a possibility. But we don't keep worrying about dying every day. We don't. Every time I get out of the car or I even sit in my car to drive to work, I can get killed in a car accident. That doesn't stop me from driving. Similarly, if there is something wrong with the baby, that doesn't mean that you or your baby is going to die. But our brain will take us there and keep on staying there and then make us do things from that place. it's avoidable. So if you want to get coached more about it, please come to a call and let us explore it more. This fear of going to that place, because once you visit that place where shit has happened, your brain somehow just releases that thought and becomes like calmer. So go there.